Okay, let's launch right into it. In case you're not familiar who Dr. Workman is, Dr. Michael Workman's a dear friend of the show and a wonderful man, but B, he's one of the best plastic surgeons in the Pacific Northwest. I have a little hair, hold on, it's bothering me. And he's done more breast augmentations than anybody else. He's got years and years of practice. He's got these skills honed down.
Oh, yeah.
So if you need any sort of body work, augmentation, lift, tuck, tighten done,
He's
from
your
the
man.
neck on down, he's the guy to go to. Now, let's talk a little bit about breast lifts as opposed to breast implants. When what would be the reason for getting one instead of the other? Like, say your breasts are perhaps not as full as they used to be, but maybe that could change. But when you hold them, when you cup them under your hand
They're fine.
and lift them a little bit, they seem fine. So in a case like that, which would you use and why?
Very good question. There's basically two types of breasts. Those breasts that need to be just filled out and they're not very droopy, and those that have more than a half inch of the breast hanging below the fold.
So behind where the bra line, under where the bra line would be, if you took that bra off, where they would hang to.
Yep. In fact, what I always do is we draw a horizontal line, parallel with the what we call it, the inframammary fold of the breast, and then just look straight ahead. And if you have much more than an inch of tissue that hangs below that fold, we need to probably start thinking about doing some sort of a lift.
Okay, then what happens when you do a lift? What's the procedure?
Well, typically what we do is, if you think about it, we've got too much skin from the basically the neck down to the nipple, and so we remove like a moon-shaped or a crescent-shaped piece of skin above the nipple and shift it up, and then we actually excise some of the tissue below. We remove some of that hanging tissue so that it is no longer hanging. And basically what that'll do for most women, it gets that nipple up out of the southern hemisphere, and it gets so we have no breast tissue hanging below.
So the nipple's not looking at the ground; it's more looking right in the eye.
Exactly. But then we use the implant to fill it up, because we oftentimes at that point you have what I call kind of a ski jump type breast. In other words, we really haven't filled out the volume up top. And women like perkiness. Young breasts are perky. They have a lot of
Some men do too,
push.
I understand.
Yeah.
I've heard.
No, absolutely. And so that's what the implant or the augmentation fills out the breast, and the lift portion we only do if you have tissue hanging down below that fold.
So where are the scars present on a breast that's been lifted?
Well, it can vary. Oftentimes they're around the nipple, and sometimes they'll be from the nipple going down to that fold.
Like a seam.
Yeah, like a lollipop. We call that a lollipop.
The line going up to the nipple.
Yeah, so go from 6 o'clock on your areola, which is the bottom portion of the nipple.
Mine's digital.
Oh, is it? Oh, yeah, it is. And draw a line straight.
I'm sorry, that was pretty good. That was not, yes, that was not bad at all.
But just draw a line straight down from your nipple right down to that fold, and that's the area where we remove that section or that wedge of tissue.
And how breasts start to droop at all different ages according to genetics and athletic activity and stuff like that, don't they?
And size.
And
size
size.
is just huge. No pun intended.
Why, thank you.
Yeah, but like there's kind of a saying, look at the girls or the young women in high school that were double D. By the time they're in their 30s, virtually all of them have fallen down. The female breast for most people is not designed to hold a lot of weight up high. So it's an age and a weight deal.
Or design flaw.
Sorry, fair.
I don't see
yes.
why you couldn't just take like a pinch of skin above the breast and pull it up and up and up and up
Over the
until it went
shoulder.
over the shoulder, and then just kind of stitch it right there over the shoulder.
That makes sense.
We actually can do that if we take the ponytail and just keep wrapping it around and around.
No, wait a minute. No, that's for a facelift. You just tighten the ponytail
Yeah,
as
but
tight as you can possibly
There's a
get.
2-for-1 if you keep twisting on it. It'll pull those breasts up a little bit.
Now, when you're doing a tummy tuck and a breast lift or implant at the same time, my wondering is always how come one thing doesn't pull the other thing down? Like
Oh,
how
yeah.
come, and when you're getting a tummy tuck, how come that doesn't pull the breast level down lower?
That's a very good question, and that's because at that fold we talked about, that fold is created by really tough tissue that anchors that fold to the underlying tissue, such that we can then pull that tummy skin down, but it won't. That area that's kind of we call it connective tissue doesn't move at all.
Here's kind of a strange question that I don't think we've ever asked, and that is if you're doing a mommy makeover, which is a tummy tuck, maybe some liposuction, and a breast lift, What do you do first?
It
Usually
doesn't matter.
Does it go breast tummy or tummy breast?
we tend to go with the breast first, especially if we're putting in an implant for sterility reasons. So that you always want to go from clean to dirtier areas.
Filthy,
To filthy,
dirty,
yes.
grimy area.
Yes.
And is it true that you put a person that you're performing a breast implant or breast augmentation on sort of a moving gurney so you can see how the breasts fall?
Absolutely.
Oh my gosh.
Absolutely.
So weird.
Never
Yeah.
even thought about that.
Well, breasts
Makes
look
sense.
totally different, on your back than they do lying up,
Yeah.
and we want to get them as close as we can when someone's straight up and down. So we literally will bring the back of the table up almost 90 degrees, and then I go around and I actually look down, from the same portion, from the same position that a woman will look at.
If you need somebody, if that's too much,
Yeah.
and you need someone to
I'm
do
in.
that for you, Ted can take
Yep.
that
Okay,
role.
okay,
I'm in.
excellent.
Do you ever make them jog so they can see what it's going to look like when they're running on the beach or anything?
You mean when they're unconscious?
Yeah, it's going to bounce up and down.
Weekend at Bernie's?
Yeah, we can have brains. Well, we haven't done that
Do
yet.
it!
If you have questions about a procedure for Dr. Michael Workman, he's here right now to answer those questions. Maybe this is the year that you're thinking, yep, you know what, I'm tired of my body looking this way. I want it to look the way that I've dreamed it could, or the way it looked a couple years ago,
Yeah.
or the way that I always imagined, but there's just these spots thanks to, genetics. I'll always have my Aunt Shirley's butt, no matter what else I do.
Oh, Aunt Shirley.
888-733-5105. I don't have an Aunt Shirley, but I imagine if I did, she'd have
her
a
butt.
She'd have a butt.
Yeah, I tell you what.
888-733-5105. Your questions for Dr. Michael Workman. The doc's response right after this.
Amy Nicole, what's your question for Dr. Workman?
Well, I was just wondering, if you're going in for a C-section, is it possible that you can do a tummy tuck afterwards, like at the same time?
That's a really
Yeah, why
common
not?
question.
Yeah, a very good question. Sometimes I think that depending upon how long the procedure takes and blood loss and all that, a lot of plastic surgeons would prefer to actually wait a little bit. The advantage with waiting is the remaining skin will have contracted a lot more, and you probably can get more tissue out, and you can probably get a little better job done.
Because you
Okay.
shrink up a little bit, don't you? I mean,
Exactly.
yeah.
Yeah.
I figure you're in there anyway, so.
Yeah, I mean,
That's a good question.
sometimes it's done that way, but I think it's you probably get a better result if you do it on a delayed basis.
Okay. And is the recovery time about the same as, like, recovering from a C-section?
Yeah, most women say it's not as bad as a C-section. I think that we're not going all the way through the muscles. We're not going quite as deep, and it's cutting the muscles that are really painful.
Okay. Yeah, I've had 2 C-sections, and I have a lot of scar tissue built up, and, I mean, I've lost all my baby weight, and I'm ready to go in there and have that done, and I just got to clean that area up.
And it'll take out a lot of that C-section scarring, won't it?
Oh yeah, normally we try to go below your C-section scar, right at the level of your pubic hair, and so we can usually get rid of an awful lot of that scar tissue for you.
Okay. Good to know. Thank you.
You're welcome.
Our guest is cosmetic surgeon Dr. Michael Workman. Hi, Vanessa. What's your question?
Well, I was wondering, when you were talking about breasts and nipples facing downward versus forward,
Sure.
what happens in surgery if you're lifting the breast but the nipples still face forward? How do you approach that differently?
You said I'm sorry. You said the nipple faces forward or down?
It still looks out. No, it does not look down. It still looks out as if the breast is where it's supposed to be, only they've moved down quite a bit over the years.
Well, we can. I mean, we
Oh,
can.
so
act-
you're
I'm
saying
sorry.
the breast is where it should be, just the nipples have changed?
No, the opposite. The nipples are where they should be, but
Okay.
the breast is moved much further down.
If you're looking
Oh,
at like a
yep.
teardrop
Oh, I
shape, the
see. So
teardrop
they
is
haven't
extended.
moved their whole head, they've just lowered their chin.
That's correct.
Yeah, exactly. We call that we actually have a term for that. It's called bottoming out. In other words, the bottom.
Very nice.
Well, no. It just means that the bottom or the lower portion of the breast has drooped a little bit, and the nipple can stay in the proper location. So in that case, we need to do a lift where we primarily remove tissue below the nipple, i.e., where that extra tissue is, from bottoming out.
Okay.
Okay, great. Thank you.
Thanks,
You're
Vanessa.
welcome.
Hi, Lacey. What's your question for Dr. Workman?
Hi, so I have a question. I had a breast augmentation about 2 years ago, and was really happy at first with the results. But now I'm kind of noticing that rippling is already taken into effect, and it's only been 2 years. And I was curious if that was common.
And
Sure.
what is that rippling and what causes it?
Rippling basically is seeing the outer shell of the implant, which can, when you hold it up, can actually have some ripples.
Could she
in
have
it.
lost weight?
She could have lost weight, she could have lost glandular breast tissue, or the weight of the implants could have stretched out and thinned your tissue. So it's almost always due to less tissue on top of, or covering the ripples that are always in the implant. Things we do to correct that are switching over to a silicone gel implant. Oftentimes that'll help, or sometimes just gaining a little bit of weight.
There's a new implant that you brought in that has almost no rippling at all.
Yes, and some of the newer high-profile implants tend to have less rippling, Doctor.
Look, I just have a good memory, that's all.
So she should go back to her surgeon, perhaps. And
I would check back with your surgeon. Yeah, and if your weight's gone down, I'd chow down.
Well, my weight hasn't gone down
Okay.
too much. I mean, not at all, hardly. I just, I had it done under the muscle, and just for whatever reason, like if I tense up or I'm doing sports, it's like I can see the ripple right there. And it's kind of, I don't know, I'm self-conscious about it.
sure.
Sure. Well, sometimes when we do put them under the muscle, when you contract your muscle, it can look a little bit funny. And yet,
Right, exactly. That's
Yeah.
what I was like.
we call that kind of window shading.
Yeah,
And
we're a name for everything, don't you?
well, we try to. But the problem with window shading is we're much better off to have that implant under the muscle in most cases. For mammograms and for just for a variety of reasons. And I'll tell people ahead of time, this is something we have to worry about. But you're still much better off to have it under the muscle.
Good luck, Lacey.
Yeah, okay.
And we're all out of time for this go around with Dr. Workman.
If you'd like to check out his website, which includes some great before and after pictures, as well as information on financing, you can ask questions there as well, different procedures that are performed at his 2 locations. You can go to drmichaelworkman.com. That's, of course, linkable from our website as well. And we'll see you back here in 2 weeks, Doc. Thank you.
All right.
Thanks, Doctor.
Thanks.